Welcome to another Hot Topic Tuesday. In prevention work, substance abuse is not a standalone issue. We recognize that substance misuse and abuse is a response that is weaved from the complexities of life's experiences, environment, conditions, and emotions. My name is Jessica Abaya, and I am a community organizer in the city of Gardena. I will be co-facilitating with my colleague, Miss Tiffany Tan from El Segundo. And today's topic, we bring to you the Great American Smokeout, Youth Insights on Preventing Tobacco Use. The Great American Smokeout is observed on the third Thursday of November. The American Cancer Society has served to be the host of this event for more than 40 years. The purpose of this event is to provide an opportunity for individuals and communities to quit or make a plan to quit tobacco use, starting on the day of the event. On November 18, 1976, the California division of the American Cancer Society successfully prompted almost 1 million smokers to quit for that day. The California event marked the first Great American Smokeout. The Great American Smokeout provided the momentum for advocacy efforts that had somehow contributed to the achievement of significant landmarks in public policy. To name a few, in 1977, Berkeley, California became the first community to limit smoking in restaurants and other places. In 1990, the federal smoke-free law for all domestic flights of 6 hours or less took effect. And in 2009, the Family Smoking Prevention and Tobacco Control Act was signed into law, which gives the FDA the authority to regulate the sale, manufacturing, and marketing of tobacco products and protects children from the tobacco industry's marketing practices. While smoking prevalence rates have dropped from 42% in 1965 to about 15.5% in 2016, or within a period of more than 5 decades, still 37.8 million Americans smoke cigarettes. Smoking remains to be the #1 cause of preventable deaths in the United States. Each year, more than 480,000 people in the United States die from illnesses caused by smoking. This means that each year smoking causes 1 out of 5 deaths in the United States. Cigarette smoking is the leading cause of cancer death in the United States, accounting for 29% of all cancer deaths. Further, the emergence of the novel products, vaping, electronic cigarettes, and the surge in their use, especially by the youth, has practically erased past progress made by advocacy efforts in reducing youth tobacco product use. A vital signs reported by the Center for Disease Control and Prevention, CDC, showed that there were 1.5 more youth e-cigarette users in 2018 than in 2017 in the United States. That is equivalent to more than 1 in 4 high school students and about 1 in 14 middle school students currently using tobacco products in 2018. Flavors in tobacco products, whether they are conventional cigarettes, cigars, and cigarillos, or electronic cigarettes, vaping products, that are attracting the youth to use these products. Data from the California Department of Public Health have established that 80% of young people who have ever started tobacco use has started with a flavored tobacco product. Flavors mask the harshness of nicotine, the addictive substance in tobacco products, so much so that the US Surgeon General has warned that flavored tobacco products help new users establish habits that can lead to long-term addiction. Nicotine products like tobacco and e-cigarette vapes are addictive and increase the risk for serious health problems like irreversible lung damage, heart disease, cancer, and permanent brain damage in the case of youth whose brains are still developing. Today, we will focus on the Great American Smokeout as an event to draw attention to preventing youth use of tobacco products or preventing youth to initiate the use of tobacco products. We keep in mind the mantra, now is the time to stop smoking, but better yet, don't even start. May I now call on my colleague, Tiffany Tan, to walk us through an activity that will provide insights into how youth and young adults look at tobacco use and their exposure to tobacco products, and also what they can do to keep people and communities safe from the harms of tobacco.
Thank you, Jessica. So now we're going to segue into an activity and highlight called the I Am Poem. And this was really fitting with the Great American Smokeout because this activity highlights the youth insight to preventing tobacco use. So the I Am Poem is really simple, but all the more very powerful. It requires something to write with as well as something to write on. And we were able to facilitate this with youth. And it's really straightforward and also really personalized. And so essentially the youth or young adult or anyone who's interested in participating will just fill in the blanks and I'll read the poem and you'll get along with it. I am your name. I am a nickname you go by. I am a food you like to eat. I am your hobbies and things you are into. I am a dream job you want. I am how do you see tobacco products in your life? I hear what kind of message do you hear about tobacco products? I am how are you affected by tobacco products? And lastly, I am what can you do to stop tobacco from hurting your community and people? So we gave some of the youth about 2 to 3 minutes. It could extend a little bit to 5 minutes because it's really thought provoking. And when it's personalized, that's where the impact poem comes from this activity. And so I wanted to highlight some of the youth's insight as to why they stay tobacco free, as well as prevent any tobacco use in their lives, as well as throughout with their peers. And feel free to read along as we listen to Angela and her I Am poem.
I am Angela Biss. I am Angie or AJ. I am Curry. I am drawing and listening to music. I am an animator. I am kids vaping in bathroom or classes. I am a relaxant and an antidepressant. I am inhaling secondhand smoke. I am advocating the truth about tobacco products and acting on prevention.
Thank you, Angela. And so Angela is a current junior from Carson High School. She's a member of the Carson Student Health Advocates, and she was able to participate and really personalize in how and what ways does tobacco affect her, what are her dream goals, and let alone what she wants to do to prevent tobacco use in her community as well as in her future. So thank you, Angela. Next, I also want to highlight a young adult and listen in as also with Francisco's I Am poem.
I am Francisco Zuniga. I am a Pokemon master. I am a soda fries. I am a walker. I am a CEO. I am tobacco free. I hear tobacco chemicals affect your brain. I am cough free. I am an educator bringing awareness about effects of tobacco.
Thank you, Francisco. And Francisco is a current senior from Cal State Dominguez Hills pursuing his Bachelor of Science in Community Health. So all the best to him. He's also our intern for this fall, and he's doing a great job interning as well as being part of our young adult coalition. And so what you've heard already from two highlights is that something simple as an I Am poem, something simple that personalizes it is really powerful, especially when there's a call to action or there's a specific topic that calls to them as to how, in this case, tobacco is affecting them. One other item that I also wanted to share is one of the rules that I have for myself as I work with the youth is that I don't want to ask the youth for something that I'm not willing to ask for myself. And that also kind of includes being really straight and formal, but also being open and kind of being vulnerable about how tobacco has affected myself as a young adult, let alone even when I'm working with the youth. So I thought it was also really fitting that I also share my I Am poem. And I had lots of fun doing it because it was really reflective. And just listening to the youth, I also felt that I can also empathize with them. So here is my I Am poem. I am Tiffany Tan. I am Cambodian food and tacos. I am watching movies and doing my nails. I am a TV host. I am aware on how the tobacco industry targets our youth. I hear that flavors hook kids. I am a daughter who hopes her dad quits smoking. I am a community organizer, empowering parents, family, and the community through education for a healthy future. And so I'll bring up the I Am poem again. As you've listened and also read along, it's really personalizing and it's also really engaging. So this was actually facilitated in our youth group, but this can also be facilitated in your young adult or adult coalition because it's also really fitting as maybe even the starting point for young adults or youth to share when they want to do a public comment or provide their testimonies in front of their city council, especially when we're tying in their lives, their experiences, and their insights to a specific topic that's affecting them in their community. So with that, thank you very much for listening to this segment of the I Am poem. I will transition it back to Jessica to finish out the remainder of the Great American Smokeout Youth Insights to Preventing Tobacco Use. Thank you.
Perfect. Thank you so much, Tiffany. And so now moving along for more information on how you can quit tobacco today. Here are some resources on Quitlines. We have Kick It California, which is formerly the California Smokers Helpline, American Cancer Society, American Lung Association, National Cancer Institute, and the U.S. Department of Health and Human Services. These are just a few of the many resources that are available to you all. And so we come to a close. Thank you for watching today's episode, and thank you everyone for listening. Please check out our social media pages and YouTube for more helpful videos on substance abuse prevention work. People need people. Thank you.